Medical science has once again pushed the boundaries of possibility with a procedure that sounds like it belongs in a futuristic novel rather than a hospital operating room. A Canadian man, blind for decades, is now seeing again thanks to an innovative surgery that uses one of his own teeth as the foundation for an artificial lens. This breakthrough represents not just an astonishing technical achievement, but also a renewed sense of hope for individuals suffering from severe corneal blindness. The successful implementation of this technique in Canada marks a significant milestone, opening doors for many more patients who previously had no options left. Brent Chapman, the patient at the center of this groundbreaking case, initially found the idea of implanting a tooth in his eye difficult to grasp. However, after hearing the inspiring story of an Australian woman who regained her sight through the same procedure and was even able to ski after 2 decades of blindness, he knew he had to take the chance. His decision has now placed him at the forefront of medical history as Canada successfully completes its first osteodontokeratoprosthesis, OKP, commonly known as tooth-in-eye surgery. The OKP procedure is an ingenious solution to the complex problem of corneal blindness, particularly for patients who are not candidates for traditional corneal transplants. It involves a meticulous 2-stage process that unfolds over several months. First, doctors extract a tooth, typically a canine, reshape it, and insert a small optical lens within it. This tooth-lens combination is then implanted into the patient's cheek, allowing it to develop the necessary blood vessels and soft tissue. Once ready, it is carefully transplanted into the eye, where it functions as a new, highly durable vision-restoring device. The result is a striking yet effective transformation, a functional eye with a small, circular window through which the patient can see. This procedure may seem unconventional, but it is grounded in sound medical science. The dentine in human teeth is remarkably strong and biocompatible, making it an ideal material to house an optical lens. Unlike synthetic implants, which may trigger immune rejection, the body naturally accepts its own tissue. This key advantage leads to significantly higher long-term success rates. In fact, a 2022 Italian study found that 94% of OKP patients retain their vision for an average of 27 years post-surgery, an astounding outcome for a procedure often considered a last resort. While not a universal solution for all forms of blindness, OKP is a life-changing option for those suffering from corneal damage due to autoimmune diseases, chemical burns, or severe scarring. The success of this surgery relies on the patient's optic nerve and retina remaining functional, making careful candidate selection crucial. Although the procedure is complex and carries risks, including potential infections, surgical complications, and implant failure, its benefits far outweigh the challenges for those who have exhausted all other options. For Chapman, the significance of this procedure extends beyond just regaining sight. After enduring over 50 unsuccessful eye surgeries in the past 2 decades, this operation offers something that had seemed almost unattainable: a second chance at life. If his final surgery goes as planned, he looks forward to doing the things he once loved: playing basketball, traveling, and seeing the faces of his loved ones once more. Beyond its impact on individual patients, the introduction of OKP in Canada represents a transformative step for the country's medical landscape. Until now, Canadians needing this surgery had to travel abroad, adding financial and logistical burdens to an already challenging situation. Thanks to the efforts of Dr. Greg Maloney and his team, Canada now has its first dedicated OKP clinic at Mount St. Joseph Hospital in Vancouver. With generous funding from the St. Paul's Foundation, the clinic will be supported for its initial 3 years before becoming a permanent part of Providence Healthcare's annual budget. This development means that more patients will have access to this remarkable procedure without having to leave the country. Dr. Samir Jabbour, an ophthalmologist at the Centre Hospitalier de l'Université de Montréal, has praised the initiative, calling it a major step forward for Canadian medicine. While OKP remains a rare procedure, its availability in Canada provides new opportunities for those with no other options, reaffirming the country's commitment to cutting-edge medical advancements. The story of Brent Chapman is more than just a medical breakthrough. It is a testament to human resilience, scientific ingenuity, and the unwavering pursuit of solutions that change lives. This extraordinary fusion of dentistry and ophthalmology, once an almost unimaginable concept, is now a reality that is restoring sight and hope to those who had lost both. As this procedure gains recognition and accessibility, it paves the way for a future where even the most complex forms of blindness can be treated, allowing more people to experience the profound joy of seeing the world once again.